First of all, I would like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video, your face in the video. Another reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Ready? Somebody, Midler class, do you want to be with us? Midler class, okay. 1, 2, Lorly, you're not yet. 1, 2, 3. Okay. Yes. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk in May 15, 2021. There are 3 courses in the pep talk. I completed the core course seen here on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder courses and health issue courses. This may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. Actually, we are now on our 3rd year. My pep talk today is entitled Gout Arthritis. The empowerment objective is for the lay people to have an essential understanding of gout arthritis in their health management. Here are the contents of this pep talk this afternoon. What is a gout? What is a gout arthritis? What is the cause of gout arthritis? What is hyperuricemia? And what are the causes of this hyperuricemia? What are the side effects of hyperuricemia? What are the risk factors for gout arthritis? What are the modifiable causes of hyperuricemia that one can avoid to prevent gout arthritis? And what joints are usually affected by gout arthritis? What are the phases or stages of gout arthritis? When to suspect gout arthritis, and how to differentiate from other types of arthritis. What is the management of gout arthritis? And then the last topic will be, is there a cure for arthritis, whether it's gout or osteoarthritis or rheumatoid arthritis? Before I proceed any further, I'd like to make a disclaimer that the contents of this pep talk will consist of my thoughts, perceptions, opinions, and recommendations, or what I call TPORs, culled from personal experiences as well as from other professionals. Let's start with the first topic. What is a gout? What is a gout arthritis? We commonly hear the people saying, I have a gout, I have a gout. What does it really mean? So when you say gout, it's really is essentially it's a form of arthritis. When we gout, automatically we're referring it as an arthritis. So automatically, when you say gout, it's gout arthritis. So, and gout arthritis is an arthritis caused by the deposition, yung mga dumadapo ng uric crystals on the joint. Okay. And then that's the one causing the inflammation, yung mga uric crystals. So that's why you have pain, you have inflammation, and therefore, yung uric acid na yun, if they are present in the joint causing the pain, we call that gout arthritis. So the generic name arthritis is it's defined as an inflammation of a joint of several joints. But arthritis, it can mean anything. It can be caused by a lot of things. Okay. So, but basically, arthritis is the generic name for the inflammation of a joint or kasu-kasuan, no? Or several joints, one or several. Note that not all arthritis are due to gout. There are other causes of arthritis, such as rheumatoid arthritis and osteoarthritis. These are the more common ones that I have seen in clinical practice. So gout arthritis, osteoarthritis, and rheumatoid arthritis. What is the cause of gout arthritis? Gout arthritis is caused by too much uric acid in the blood. The other medical term for this too much uric acid is hyperuricemia, uric acid. Emia means in the blood. So too much uric acid in the blood that leads to the deposition of the crystals, of the uric crystals in a joint or several joints, causing inflammation. So illustrated here is that these are the crystals, okay, because of hyperuricemia, maraming uric acid, so nagcrystallize into crystals, and then nagdi-deposit ito sa joint, and then pag na-deposit na ito sa joint, magsaswell ang joint, magkakos ng inflammation, and therefore pain. Sasakit na yun. No? So what is hyperuricemia and what are the causes? Bakit tumataas yung uric acid sa dugo natin? Hyperuricemia occurs when uric acid levels in the blood are too high. So pag normal, we don't call that hyperuricemia. If it's too low naman, pero bihira yung too low, you can call it hypouricemia. Okay. Pero kadalasan, it's either normal or mataas, hyperuricemia. So, ang main culprit dito sa hyperuricemia is the uric acid. So, saan nanggagaling ang uric acid? The uric acid is produced when the body breaks down a chemical called purine. The purine occurs naturally in the body, but also it's found in certain foods. Okay, so sa katawan, may natural production of purine, at yung mga pagkain natin, meron ding mga purine. So yung after the purine is breakdown into uric acid, this is eliminated o nilalabas ng katawan through the urine, through the kidney. So if the kidney is unable to clear the uric acid fast enough, baka masyadong marami, so there will be accumulation of the uric acid in the blood, and therefore it will end up, one will end up with too much uric acid in the blood. So what is called hyperuricemia. Hyperuricemia occurs when uric acid levels in the blood are too high. That's the basic definition of hyperuricemia. And this elevation is the result of, number one, it could be increased production or decreased excretion, hindi nilalabas, okay, or combination of both processes. So basically, ito yung mga processes of elevated one, increased production, decreased excretion, and then or combination. So what are the usual causes of overproduction of the uric acid? Kung yung diet mo is very high in purine, So tataas talaga yung uric acid mo after the breakdown of the purine into uric acid. And then number 2 will be an error in the purine metabolism. Yung mga congenital defect, no, mga problema na mahirap i-break down yung purine, no? So you will have accumulation of the uric acid. And then the other one is the cell breakdown or turnover. Example, common maraming causes dyan, hemolysis, yung mga tumor lysis, ganun. But I will just cite exercise can also be a cause. Pag too much exercise, it can cause excessive breakdown of the cells, and it can cause hyperuricemia. Pero bihira lang ito. But theoretically, it can happen, especially for those who might be exercising too much also. Okay. Now, for the decreased production or excretion, ayaw nag-accumulate because hindi nilalabas ng kidney. Okay. So, naturally, if you have problem with kidney, acute or chronic, nag-accumulate yung uric acid. Okay. So, hindi makalabas. So, as we said, uric acid is excreted by the kidney through the urine. The other major cause is medications. Kung marami tayong iniinom ng mga gamot, no, side effects na yon could be decreased uric acid excretion also. And then the other one is yung mga toxin like alcohol. Alcohol can also cause a decreased uric acid excretion. So I just highlighted in yellow color those which are common. The other ones, very sophisticated na sa inyo, so pwedeng hindi na masyadong pansinin. Basta tandaan na yung chronic kidney disease, medication, toxin, and alcohol. Yan ang possible causes of hyperuricemia due to decreased uric acid excretion. So, anong mangyayari kung mataas ang uric acid sa katawan, sa dugo? Okay. It can cause, number one, the more common cause is gout arthritis. Number two, it can also cause kidney stones. So yung mga uric crystals nagpo-form din ng stones sa kidney. Okay. So itong pinaka-two most common side effects of hyperuricemia kung hindi makontrol yung hyperuricemia. So what are the risk factors for arthritis? Gout arthritis is more common in men than in women, but those women who are into menopause, no, tumataas ang incidence ng gout arthritis. But in general, it's more common in men. Okay. Now, another risk factor is overweight or obesity, alcohol, excessive intake of alcohol, family history of gout, pwede rin. Then maintenance medicine such as diuretics that help yung sa high blood pressure, no? Marami tayong umiinom ng diuretics, kung matagal iniinom, pwede ding tumaas yung uric acid in the blood. Okay? And then the other metabolic syndromes such as hypertension, hypercholesterolemia, diabetes, and heart disease. Okay. So, what are the modifiable causes of hyperuricemia that one can avoid to prevent gout arthritis? In the previous slides, may binanggit ako mga maraming factors, but some of them cannot be modified, like age, but yung sex, no? Yung lalaki, babae, wala kang magagawa doon, no? Okay. So we talk of things that can be prevented, no? Modifiable. So yung mga overweight and obesity, pwedeng iwasan yon, no? Then increased in consumption of sugar-sweetened beverages, marami sa ating umiinom yan. And then mga pagkain, food rich in purines, no? So we can also avoid that. Okay. And then alcohol, of course. Okay. So itong mga three most common factors which can be lessened, which can be prevented. So i-decrease lang yung pag-inom ng sugar-sweetened beverages, and then iwasan lang yung kumakain ng masyado ng food rich in purines and also alcohol. So what joints are usually affected by gout arthritis? Ang pinaka-common, I don't know the reason, no? Big toe. ang pinaka-common, big toe. To the point that if you have affectation of the big toe, meron kang arthritis, ang unang iisipin mo, gout arthritis. But as I said, not all arthritis are due to gout. Okay? Pero based on statistics, ito yung pinaka-common. But it may also affect other joints, as I will show you some pictures later on. No? So like the ankle, knee, the hand, the wrist, and elbow. So kahit saan pwede actually. No? What are the phases and stages of gout arthritis? Okay. May mga early stage, may mga late stage. No? Just like sa cancer, may stage 1, stage 4. Ganun din sa gout, may early stage, may late stage. No? Depende na kung saan nahuhuli or kung makokontrol natin. No? So the first stage is meron kang hyperuricemia pero wala kang nararamdaman. Okay? Asymptomatic hyperuricemia. Okay. Then the other one, pag meron ng mga crystals na dumapo doon sa joint, sasakit na yon, so you can have attack already, acute gout arthritis. And then after the first attack, magre-resolve siya because of probably less na yung pagkain mo sa purine, tapos umiinom kayong maraming tubig at may gamot, no? Natatanggal yung arthritis, no? Pero magkakaroon siya ng recurrent attacks, no? So yung in the interval between the recurrent attacks, we call that intercritical gout. So this is the intervals within acute attacks. Okay? So after an attack of acute gout, pwedeng umulit siya. Now, yung pagitan ng first and second or second and third will be the so-called intercritical gout. The fourth stage, which is the pinaka-advanced na, meron ka ng deposition of the so-called tophi, or we call it chronic topaceous gout. Now, okay, I'll show you a picture of that. Okay. So majority of people have asymptomatic uricemia because of excessive purine-rich food intake. That's a reality. Marami tayong kinakain, no? Maraming hindi natin tayo pumipili kung anong kinakain natin. So usually we end up with a lot of uric acid in the blood. Pero fortunately, majority are still asymptomatic. Pero we should not be complacent on that. No? So dapat i-control natin yung hyperuricemia because one day you will have an acute gout attack. Okay? So ito yung illustrations of the stages. High uric acid, ito yung hyperuricemia. As asymptomatic, wala pang symptoms. Ito, nagkaroon ng attack na, first attack, acute flares or recurrent, and then yung intervals between the attacks, no? Intercritical periods, silent lang siya, hindi masakit, pero you would anticipate another attack would come in if you don't control the hyperuricemia. And then the last one, the advanced gout, will be talagang permanent na yon. Andun yung symptoms, no? So frequent, constant joint pain, and then there is the so-called tophi. Now, I will explain that later on. So this is an illustration. So ito yung mga sharp needle-like uric acid crystals. Kung mataas ang uric acid sa blood, magdideposit siya, magkakaroon siya ng inflammation, and then kung tuloy-tuloy pa rin ang build-up ng uric acid crystals because of no control in the diet, in the overproduction of the uric acid, and also decreased excretion of the uric acid, magbi-build up yung uric acid to the point na magkakos, continuous ito, tuloy-tuloy, magkakos ng tophi formation. So dapat dito pa lang, symptomatic, i-control na natin. Kung umabot tayo ng acute gout arthritis, i-control natin para hindi na tayo umabot dito sa chronic topaceous gout. So ito yung sinasabi kong tophi. No? So magkakaroon ka ng mga whitish bukol, no? Yon, sa mga joint, parang bukol-bukol na, pero puti ang itsura. Yan ang kulay ng tophi. No? Okay. Yon. Magkakaroon ng deformity. So you have the big toe, finger, sa finger ito, pwede mangyari. As I said, hindi lang yung big toe, but other joints can be affected. So again, ito rin, no? So, karon ng masses of uric acid, we call that tophi already, no? Ito dito sa daliri, no? Sa may wrist, part of the hands already, elbow pwede rin, no? Okay. So, kadalasan yung nakikita ko sa paa, sa kamay, sa elbow. Okay. So, when to suspect gout arthritis? Doctors usually diagnose gout based on your symptoms and the appearance of affected joint. Usually, pag may tophi, sigurado na tayo, no? And then, based on the symptoms, as I said, ang pinaka-most common will be the big toe. So, kung may affected ng big toe, suspect na kagad. At kung masakit na masakit, usually, gout is usually due to gout already. But not, as I said, not all arthritis are due to gout. Meron pang ibang causes. Kung di sigurado, kung it's due to gout or due to osteoarthritis or due to rheumatoid arthritis, then there's a need to do some diagnostic tests. But the typical symptoms of gout in acute attack, kung asymptomatic, hindi mo madadiagnose, wala kang nararamdaman. Pero kung yung first time na inatake ka na, no? Then, ito yung mga symptoms, sudden, biglaan, sudden attacks of severe, masakit na masakit, often with redness and swelling, mapula at namamaga around the joint. Again, most commonly in the big toe. But as I said, it can occur anywhere. Not all joint pains with swelling and inflammations are gout arthritis. We have to remember that kasi in practice, pag marami akong pasyente sinasabi, ay may gout arthritis ako kasi masakit ang tuhod ko. So they usually attribute it to gout. But most of the time, from my experience, it's not really gout. No? Baka osteoarthritis mas common because of the aging process. No? Okay. So when you have arthritis, one has to differentiate gout arthritis from two other common arthritis, which are osteoarthritis and rheumatoid arthritis. Mas common, I think mas common, pinaka-common ito is osteoarthritis, especially those sa mga matatanda na, mga may edad. No? Okay. Then rheumatoid is not as common as these two. So this illustrates the common types of arthritis, which is osteo, rheumatoid, and gout. As we said, sa gout, meron kang uric acid crystals deposition, then kung matagalan, then you can have tophus. Ang cause ng rheumatoid arthritis usually swelling ng membrane. Iba ang cause, not deposition of the crystals. Magkakaroon ng sakit din. No? And then osteoarthritis, wear and tear ito, no? Because of yung mga part of aging, part of stressful activity, gano'n. No? So this table again shows the differentiation among the three common. No? Okay. So osteoarthritis, breakdown of joint cartilage. No? And then ito sa rheumatoid arthritis, inflammation of the membrane lining the joint. Okay. Whereas in the gout, yung crystal acid ang nagkakos. So gout, ito yung summary of how to differentiate. When you have big toe involvement, now, then you think yung masakit na masakit, you think of gout. Okay. Now, kung may chalk-like substance, puti, chalk-like substance, tophi, again, 99% gout na yan. Now, kung wala itong dalawa, itong symptoms na ito, you start thinking of baka osteoarthritis. Now, especially in the yung mga elderly patients. No? So, usually with pain, but not as intense and gradual as gout. Sa gout kasi sudden, masakit na masakit. Yung osteoarthritis, kuminsan masakit, pero usually gradual lang siya. Okay. And then, there is morning stiffness. Paggising sa umaga, ay ang higpit-higpit, masakit yung katawan, yung mga joints, no? Pero pag nilakad na, ginalaw na, nawawala. So that's a sign of osteoarthritis. No? So lalo na pain on movement, yung yuyuko, ang sakit, no? And then the other differentiating point between osteo and rheumatoid, usually asymmetrical. When you say asymmetrical joint involvement, one side lang, okay, hindi siya bilateral. Whereas rheumatoid arthritis, ang joint involvement no, usually kabilaan, right and left. So that's how you differentiate these three. Okay. So, ito nga, no? This is the rheumatoid osteoarthritis, as I said, okay? Symmetrical siya. Dito sa rheumatoid, right and left meron. Dito sa osteoarthritis, asymmetrical, one side lang, no? Either this left leg, left knee, or right elbow, or dito sa hips, ganon din, okay? So, minsan mahirap nga i-differentiate, especially in the early stage of gout arthritis, mahirap i-differentiate from rheumatoid arthritis or osteoarthritis. So you have to do confirmatory test, diagnostic test. Usually yung ginagawa, if you want to know whether it's due to gout, you have a fluid test. Hihigop ng fluid sa joint ng isang doktor, and then have it test for urate crystals. Kung may urate crystals, gout siya. No? Okay. Or sometimes the blood test, commonly done, may mga blood tests, di ba? Mga uric acid test. No? Okay. Usually, it can measure the levels. No? Pero you have to take note na yung mga tests could be misleading kahit na mataas, pero wala kang nararamdaman. So you can call it asymptomatic asymptomatic gout, asymptomatic hyperuricemia, pero wala pa yung arthritis. So take note of this kasi madalas tayo nagpapatest ng uric acid, hindi ibig sabihin na kung mataas ang uric acid ninyo, may gout kayo, no? Baka wala pa, no? So you just have to control it. No? So X-ray is another way of differentiating the three kinds of gout, of arthritis. No? So yung sa X-ray, makikita mo yung tophi, no? Sa X-ray. Baka shadows of urate crystals makikita rin. Again, ultrasound can be done. No? So probably the first thing to do when you want to know what you really have, whether it's gout arthritis, osteoarthritis, or rheumatoid arthritis, you can make use of the blood test, tignan mo lang, pero huwag kayo magko-conclude kagad kung mataas yung uric acid ninyo sa blood, gout yon, no? Kung mataas na mataas, you can make an assumption, baka most likely it's due to the uric acid, pero it's not conclusive. So probably X-ray is another help that can be helped kasi itong joint fluid test, tutusukin pa yan, kaya masasaktan lang kayo. So, pwedeng blood test muna at saka X-ray. No? So, what is the management? For the acute attack, masakit na masakit, no? So you give pain medications. Usually, ang binibigay nito yung mga NSAID. NSAID means non-steroidal anti-inflammatory drugs like the mefenamic acid, ibuprofen, okay, etc. Okay? Then during the resting period, intercritical, now you can take medications to lower the uric acid. Kung mataas ang uric acid level sa blood, pababain na ninyo. No? So of course, may kasamang other strategies like yung mga pagkain natin, yung mga alcohol, yung mga beverages na bawasan na natin. Okay. So when there is a chronic gout with tophi formation, nako, mahirap na ito. Mahirap i-reverse na yon. No? So, it's either watch and wait kung kayang tiisin, no? Pangit lang tingnan, no? Pero kung hindi mo nag-attack, walang masakit, pabayaan na lang. Okay? Or, kumisan, kung mas pangit na gustong patanggal, you do surgery. Pero surgery is not easy. Kasi masisira yung joint ninyo, no? Pag inoperahan. So, yung mga prescription medicines that are being given for gout arthritis will be the NSAIDs, then allopurinol, will be a medicine that will try to reduce the uric acid production, whereas, and also this one, Fibosostat, it could also reduce the uric acid production. And the last one is colchicine, which reduces the inflammation. So kung di kaya ng NSAID, bibigyan ng colchicine. No? And then you have a choice between allopurinol and Fibostat, okay, to reduce the uric acid production. Ito yung illustrations ng surgery sa gout arthritis. Okay. As I said, pwedeng gawin, pero mahirap gawin. No? Kung isa mapipilitan nila kasi ang dami na, no? Ang pangit tingnan, gano'n, at masakit. So yan, tinatanggal. So ito yung mga tinanggal. No? Okay. So, surgery once done, kuminsan maraming side effect din sa joint. Baka masisira yung joint. So, what are the management of gout arthritis? Okay. So, foods to avoid. Stay away from these types of food. Beer and grain liquors like vodka and whiskey. Red meat, lamb and pork. Organ meats like liver, kidney. Okay. Seafood like shellfish, shrimps, lobsters, mussels, anchovies. High fructose products like soda and some juices. Okay. So, pag nakita niyo ito, paano yan? Hindi na kami iinom, hindi na kakain na. No? So, the best advice, just eat in moderation. No? Konti-konti lang. No? Okay. A little, one or two more, one more, pwede na, pero wag three or more, kasi three is a poison already, di ba? So, what are the best food for a gout? Kung may gout ka na, no? So, ito yung dito ka magpo-focus. Low-fat and non-dietary fat products such as yogurt and skim milk, fresh fruit and vegetables, nuts, peanut butter, grain, potatoes, rice, bread, and pasta, pwede. So if you have to eat eggs, eat in moderation. And then if you have to eat meat, no, gusto mo kumain, okay lang, but eat in moderation. Okay. But so the bottom line is para matandaan natin ito kasi mahirap to remember all the types of foods, no, which are pure in rich or not. Basta eat in moderation na lang. Sa drinks naman, so drink a lot of fluids, maraming tubig. No? And then, yung don'ts naman, stay away from sugary drink like soda and fruit juices. If you have to drink, you just drink once a week, ganon. Then limit or avoid alcohol together if you can avoid it. No? Okay. The last issue here is there a cure for arthritis, whether it's gout arthritis, osteoarthritis, or rheumatoid arthritis? So the answer here, the consensus here is there is no cure once it's already set in. Kung nag-set na yung crystals, nag-set in na yung mga sira sa joint that will cause yung wear and tear, nasira na, causing osteoarthritis, then rheumatoid arthritis, wala nang cure yan. Okay? So the goal na lang is to limit the pain and inflammation para you can have a better quality of life, hindi masakit palagi ang joint, and then you have to preserve the joint function. So treatment options will be exercise, weight reduction against obesity and overweight, and then eat in moderation, especially the purine-rich foods. Then, of course, the use of medicine can be done, and surgery if really needed. Kung kailangan lang for the tophi, yung maraming tophi na disabling na. So, takeaway in relation to patient empowerment on gout arthritis. Be always in touch with reliable medical information on gout arthritis. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and to make better decisions on gout arthritis in your health management. So I presented all of this, summary. Okay, but I won't read them one by one anymore kasi marami. Okay. And then, so that was the last slide. So here I end my pep talk. I hope I have empowered you to have an essential understanding of gout arthritis in your health management. So before we go to the QA, question and answer portion of the session, reminder, take the online Learning Comb Evaluation Test exercise for mastery of learning and have a certificate like this. Get a perfect score to get this certificate. And then 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. When you say voucher, it's a free medical consultation. So feedback, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the interactions. Okay. Ready? Everybody in? Susan, Christy? Susan, are you there? One. Wala. Tulog siya. 1, 2, 3. Okay. Let me save it first. Okay. So the floor is now open for questions, comments, consultations, and other things that you may want to discuss. Anything? Okay. Walang questions pa. While waiting for the questions to come in, I just have a trial here. Can you answer this poll? May 3 question lang sa poll. Pakisagot lang. Try your best. No? So, ilo-launch ka na ha. Take note. Yes or no lang ang mga sagot. No? Yes or no. No. Okay. Sagutin na lang ninyo ito. Do you have a gout right now? Yes or no? Are you taking medicines for gout? Yes or no? Are you eating anything in moderation? So, huwag kayo matakot sagutin yan. Wala namang identification yan. So, okay. Meron pa sasagot? 9, 12, 13, dalawa pa, 14, 15 tayo lahat. 14, isa pa. Okay, baka wala nang sasagot. No? Okay, for the first question, can you see the survey? Can you see it in your phone? Abet, can you see it in your phone?
Yes, I answered already.
Hindi, nakikita niya? O ako lang nakakakita ng results? Nakikita niyo?
Hindi, ikaw lang.
Okay. So ang sagot dito, sa first question, do you have a gout? So 3 out of 13 said yes. So later on, we will ask yung tatlo. No? So majority, no. 10 out of 13. Are you taking medicine for gout? Okay, lahat says no. Okay, 13 out of 13 says no. Kahit na yung tatlo na says that may gout sila. Are you eating anything in moderation? Okay. Only one says, okay, may pahabol. So majority said yes. Congratulations. No? 13 out of 14 says that they are eating anything in moderation. Only one says that no. So matakaw siya. Kain siya ng kain. No? Okay. Okay, sasara ko na itong poll. Ha? Okay. Okay. End of poll. Share results. Tingnan ko nga. Oh, I press on share results. Nakikita ninyo? Wala. Abet?
Wala.
Wala.
Ayan, yes. Yes.
Ano yung nakikita ninyo? Yung diagram? Yung diagram?
Yeah.
Yung isang, parang itong ginagalaw ko. Yan ba yung nakikita niyo?
Yes.
Okay. Yung gumagalaw? Yan ba?
Yeah.
Okay. Sige. Para alam ko rin. Hindi ko rin kabisado ito eh. Okay. Okay. So, sino yung tatlo na nagsabi na may gout? Sino? Para
We
may
have
score lang natin. Ha? Sino? So, si Ellen? Ellen? Unmute mo, Ellen. Unmute. Okay.
Yes, Doc. Kasi
Ah.
there was a time na dito sa yung finger ko dito,
Oo.
parang yung anong tawag ba dito, yung buko yung parang malaki yung dito banda,
Malaki.
yung
Parang
buto, lumaki.
lumaki.
Pero yes, Doc, pero nawala rin naman siya after a while.
Okay. Okay. So nawala.
And then naulit-ulit dito sa other dito sa kabila.
Okay.
Nagkaroon uli ng maliit na yung parang lumaki yung yung bukol dito, yung dito sa tapos ganun din, nawala naman, nag-subside.
Okay. So
Pero
kung
that time, Doc, masakit siya.
masakit na masakit o konting tolerable naman?
Konti lang naman sakit. Hindi tolerable. May time na medyo masakit.
So yung big toe mo, walang problema.
Wala, Doc.
Okay. Okay. So
Dito.
yeah.
Nag-enlarge din ito, pero
Sandali.
nawala.
Sandali. Tingnan, how do I enlarge it? Sandali. Sandali. How do I view immersive? Paano? How do I show you spotlight for everyone? Ayan. Saan? Nakikita mo? Nakikita natin? Saan? Saan ang masakit? Sa thumb.
Ito, Doc. Oo, itong
Trigger
right thumb
finger.
ko.
Trigger finger.
Okay.
Pero nung before na una, ito, yung sa ring finger, medyo lumaki ito ng konti. And then, yun nga, medyo masakit pagka tinatouch kong ganon. Tapos, pero after a while, nawala rin naman siya. And then, dito sa kabila, ganun din. Nagkaroon din ng maliit na parang, yun nga parang medyo nag-yellowish yung and then, nawala rin naman. Tapos ito yung huli, bumalik na uli sa dati. Kaya sabi ko, gout yun. I don't know.
Okay. Pati yung sa tamo, itong meron na. Hindi siya pantay?
Hindi pantay, Doc. Yes, itong isa medyo ito hindi gaano. Pero hindi na siya masakit.
Pero may swelling siya. May parang pag diniin mo, ano yan, buto?
Wala ngayon, Doc, wala na.
Pero
ito.
yung
Before meron. Yung
May-
before masakit talaga.
may maumbok dyan sa tamo.
Ngayon parang bumalik na sa normal.
Normal. Okay.
Mm-mm.
Okay. So what do we have? Okay. So as I said, okay, let's try to diagnose. Kung meron kang sa big toe, malaking suspetsya na gout, pero wala ka sa big toe, sa kamay lang. Na? Okay. So, and then, gaano katagal na yan? 1 year?
Medyo. Pero, siguro pero less than a year.
More than a year. Okay. Kung more than a
Less
year,
than.
so most likely hindi siya rheumatoid arthritis. Rheumatoid arthritis kasi permanent yan, no? Hindi siya mawawala tuloy-tuloy, no? So,
Okay, Doc.
so we're left with two possibilities. Is it really gout na doon sumakit sa kamay, sa daliri, or is it osteoarthritis? Osteoarthritis, wear and tear, no? Okay, wear and tear ng joint, no? Kung ang pain is gradual naman, tolerable, hindi siya severe pain, no? Most likely we will consider osteoarthritis. Not gout, no? Okay.
Yes,
Gout
Doc.
kasi usually masakit na masakit.
Tolerable naman.
Tolerable. Saka gradual. No?
Sa ngayon, wala na siyang pain.
So, yung sa gout kasi pwedeng magkaroon ng attack, and then after the attack, magsasubside, no? So, yun sa iyo, baka if it's really gout, nawala siya ngayon. Okay? But baka pwedeng bumalik. Di ba?
Yes, Doc.
Pero if you try to decide kung anong meron ka, most likely osteoarthritis. Hindi siya gout.
Okay, Doc.
Okay?
Thank you.
Osteoarthritis.
Thank you, Doc.
Okay. I just want to ask, meron ka bang blood test?
Wala, Doc.
Okay lang. You don't have to get a blood test. Okay? Just assume that kasi in the end, kumisan mahirap din to have a final say or to say with certainty kung talagang gout or osteoarthritis. Mahirap talaga sabihin, no? You just assume. Pwede mo na lang i-assume, baka pwedeng gout. So ang gagawin mo na lang, anong gagawin mo? Reduce your food. Yung pagkain. Yung mga pagkain na mataas, okay? So, alam mo ba yung mga pagkain na mataas sa purine? Mahirap na
Ang dami.
Ang dami, di ba? So,
halos lahat.
Halos lahat meron, no? So, just eat in moderation na lang. Ganun na lang. Best effort na lang. Okay? So, yan ang aking practical advice, no? You don't have to remember. Kung gusto mo, you can pinpoint na, kung minsan mo kasi, masasabi mo rin, pag kinain mo itong pagkain na kinain mo marami, sumasakit. Sumasakit kasi kung minsan gano'n Kasi ako rin, kung minsan pag kumakain ako ng isang tofu, no? Sumasakit ang daliri ko, no? So after yung kumain ako ng tofu 1 day or 2 days after, nawawala na, no? So since then, iniiwasan ko na yung tofu. O kaya kung kakain man ako, isang piraso lang.
Konti lang. In moderation.
Okay. So that's the approach there. No? So try to diagnose. So in diagnosis, hindi siya rheumatoid, possible, osteo and gout. Pero most likely osteo, most likely. Okay. So wag na kayo, you don't really have to go for the test. Okay.
Yes, Doc.
Gastos lang yun, ha? Just
thank you, Doc.
Eat in moderation na lang. Then, bantayan mo na lang, ha? Huwag lang siya mag-attack. Na?
Yes, Doc.
Okay? Then, exercise. I-exercise mo rin, ha? Pag osteoarthritis.
Oo nga, Doc. Ni-exercise ko.
Okay?
Thank you, Doc.
Sige. So, how about the others? Sino pang
Doktor.
Yeah, sino?
May tatanong ako, Doc.
Sino to? Si
Perla.
Perla. Okay, Perla.
Doktor kasi, Itong mga daliri ko noon, yung mahirap iunat, yung trigger finger. Ano ba yun? Trigger finger.
Trigger finger, I think, can be classified as osteoarthritis. I think, ha? Okay. Pero
O kasi
nawawala siya.
pinaopera ako dito eh.
Ha?
Pinaopera ako.
Naoperahan ka. Okay.
Oo, parang may kunting release of, ano nakalagay yun?
Oo.
Parang hiniwaan lang ng maliit na maliit, ni-release nung doktor.
Oo.
Parang aywan ko kung release o trigger finger. Tapos operada na rin po ako ng carpal tunnel both sa aking kamay.
Okay. So,
Opo, ano ba yung carpal tunnel din? Related ba sa mga ganon? Osteo o hindi naman po?
Kung when you say osteoarthritis, ang concept ng osteoarthritis, it's part of aging, it's part of wear and tear, no? Okay. So, yung carpal tunnel could be part of yung aging din because palaging yung dumidikit yung natratrap yung nerve diyan, no? Because of parang excessive use of the hands, no? Okay? Parang osteoarthritis din ang concept, no? Pero strictly speaking, hindi siya pareho, no? Ang gagawin lang naman dun sa carpal tunnel mo, i-release lang yung nakaipit dun sa nerve mo, no?
Opo.
Ipit, no? I-release
Pinaopera
lang.
ko na rin po ito eh. 2 beses, 2 kamay ko.
Okay. And then,
Na-release yung nerve.
yung trigger din, ganon, baka nakadikit lang doon, no?
Opo, pinaopera ko din po ito.
Okay, ni-release lang, no?
Ni-release na, kaya sa ngayon,
so it's
hindi
not,
pa naman bumabalik. Pero sabi nila yung carpal tunnel, bumabalik daw po yung doktor. Totoo ba yun?
pwedeng bumalik. Kasi wear and tear, lahat, pati yung trigger finger, pwedeng bumalik. At pwede ding mawala, no? Tama, kahit na without operation, pwede ding mawala. Ako, meron akong carpal tunnel for the past 30
Ay, ang kirot,
years.
doktor. Pag umaga yung carpal, ang kirot, kaya pinaopera ko po.
Kirot o manhid? Manhid.
Makirot na parang
Makirot?
yung kirot niya parang lumalalim na hindi mo maintindihan. Kaya
okay.
pinaopera ko po.
Yeah. So, kumusta na? Kailan ka nagpa-opera?
Mga matagal na rin po, doktor. Siguro itong, kasi hindi sila kasabay na una yung left, na kamay ko, then yung right kay doktor, sa Madok, si Doktor Takata. Siya nag-opera sa akin.
So, tapos hindi na umulit.
Hindi naman po, doktor, so far. Pero siyempre, ako maano kasi kayang kamay ko alam mo naman mga trabaho, mga kwan. Pero yung trigger finger ko, awa ng Diyos, hindi naman na bumalik kasi parang sinugatan lang ng maliit dito sa dulo ng daliri. Parang ganun.
Aha.
Actually, 2 daliri ko din ang na-release ng trigger finger niya
Okay. Sandali
Ayun,
carpal tunnel. So, basta hindi siya osteoarthritis ang classification.
Osteoarthritis yung doktor, carpal?
Hindi siya osteoarthritis ang classification.
Okay. Hindi rin siya mga gout, hindi rin siya, no? Opo.
Okay.
Yun lang po, Dok. Oo.
Nagawa na kita ng spotlight. Okay. So, hindi siya osteoarthritis, no? Okay. Hindi siya gout. Definitely hindi siya gout. So, sa ngayon, it's not classified as, hindi rin siya rheumatoid, no? Yung carpal tunnel is not rheumatoid. Yung trigger finger is not rheumatoid. So, it's a separate category, no? Hindi rin siya, in conventional definition ng osteoarthritis, it does not fall under that, no? So, very specific siya. Trigger finger, carpal tunnel, ganon, no? Okay. So, just a matter of releasing lang. Nire-release lang yung mga nakaipit doon.
Naipit na ugat.
Because of wear and tear. When you say wear and tear, palaging ginagamit.
Palaging ginagamit, opo.
Kaya nagkakaroon ng part of aging, di ba? Gamit, di ba?
Opo.
So yun, okay lang. So, basta okay na kung wala kang nararamdaman, okay na yun. Diba?
Wala naman po, doktor. Awa ng Diyos.
Okay. So, pero ang sinasabi ko rin sa iyo, kung minsan, you don't have to have it operated. Kung mild lang, no? So, kung minsan nawawala. Parang carpal tunnel ko, 30 years na ito, hindi ko pina-opera, no? Okay. So, tinitiis ko lang, pero nababawasan kasi kung minsan, during the pandemic, halos wala nang ginagawang operasyon, no? Okay. Kaya, nare-relief ako ng konti, no? So, ibig sabihin, pwede pang reversible ng konti, no? O pwedeng pagtiyagaan. Okay?
Ang sakit kasi noon eh.
Yeah, kung masakit na masakit, yan, no? Pero depende sa threshold, no?
Oo, makirot eh.
Okay. Okay, any more?
Okay, Doctor. Thank you very much.
Welcome.
Yeah, there's 2 questions at the chat box. One from Bilet del Rosario. Do medicines like letrozole and levothyroxine cause osteoarthritis? And another one from Susan Archel. I take high blood medicine with diuretic. How can I avoid gout?
How can you avoid
Gout.
gout? How can you avoid gout?
Gout?
Gout. Okay. Anong unang sasagutin ko? Okay. Yung kay Belet mo na. Sige, una kay Belet. Ano yung levothyroxine and ano isa? Letrozole? Okay. O sige, isabay ko na lang. Okay. So, basta ang principle noon, lahat ng medicine that we take into our body, no, intake natin, just like food, yung kinakain natin, okay, always have the potential side effects, no, lahat, no, okay. Even pagkain, di ba? Yung pagkain. So, gamot din, ganon. Gamot, no, pagkain. Pag kumain tayo, may potential side effects, no? So, ang ginagawa lang natin, so principle of management, kung anong decision making, binabalance lang natin yung benefit and then the risk, no? Kasi kung di ka kumain, you'll die of starvation. So, kakain ka. Di ba? Pero kung kumain ka, may kapalit. Di ba? So, mayroon mga side effect. Number 1, baka tumaas yung cholesterol mo, tumaas yung uric acid mo, no? Okay. Or, kung kumisan, kumakain ka ng spoiled na pagkain, mga food, kakaroon ka ng food poisoning, no? So, ibabalance mo lang yung dalawa, no? So, if you need to take letrozole, you need to take levothyroxine, you need to take yung kay Susan, yung mga anti-hypertension medicine na may diuretics, no? So you take it because it's offering some advantage, no? Okay? Para makontrol yung ano mo, yung letrozole for cancer, levothyroxine for the thyroid nodule, yung hypertension mo, yung diuretics, kinokontrol yung hypertension mo. Okay, but have in mind na may possible side effects, no? Okay. So, babantayan na lang, babantayan, no? So that's why when you also take the medicine, just like sa food, take everything in moderation. Sa medicine, you take the lowest dose possible, no? Okay, lowest dose possible. Huwag masyadong marami rin. Okay? Kaya pag nag-overdosage ka sa gamot, syempre, mas mataas ang side effect, no? Okay. So that's how I would answer that question, those 2 questions. Yung issue kasi basically is medications versus gout. Okay. So, ang gagawin na lang ninyo, it's make sure that you take the lowest dose possible so that the doctor will advise you on that. Number 2, you drink a lot of fluid. Okay. And then, yung pagkain ninyo, bawasan ninyo. Kasi baka yung gamot ninyo magpapataas ng uric acid. Pag kumain pa kayo masyadong marami na purine-rich food, tataas lalo. Di ba? Okay. So, bawasan lang ninyo, ganon. No? So, it's just a matter of balancing and then controlling everything. No? Okay? Belet? Nasagot ko ba yung tanong mo? Susan?
Yes, Doc.
Okay, Doc. Oh, I drink a lot of water after.
Yeah, drink a lot of water and then
Exercise po. Lagi
Ah.
masakit na mga kamay. Lagi masakit na kamay ko. Lagi exercise na lang ho.
exercise. Baka hindi gout yan. That's why you have to differentiate gout from
Parang osteoarthritis.
osteoarthritis, no? So, hindi ka na bata di ba?
Itong mga likod ko masakit lagi.
Ako rin, no? Wala akong sakit, no? Okay. Nakikita niyo yung ito, meron din ako osteoarthritis. Mas malaki, parang may nakausli dyan, no? Okay, hindi siya TOFI, sana hindi, no? Okay, meron din ako dyan, masakit ng sakit. This is part of osteoarthritis nito, no? Okay, so, tinitest ko na lang, and exercise ng konti, and then bawasan yung mga strenuous activity, no? Parang kung may carpal tunnel ka per leg, no? Iwasan mo lang yung mga that can cause carpal tunnel, no? Ganon, i-rest mo lang. Okay? Any more questions?
Doctor, is bunyon a kind of gout?
Bunyon.
Yeah, bunyon.
Hindi. Bunyon is excessive deposition of bone doon sa isang buto, near the joint, no? So it's not gout, no? So sino nagtanong, ikaw? Okay. So excessive deposition lang, but kung minsan mahirap nga i-differentiate kung titingnan lang kasi parang nakausli siya na tapos yung gout, kung may TOFI siya, parang pero yung TOFI makikita mo may puti, no? So, and then yung TOFI, kung minsan matigas pero hindi siya bone inconsistency. Kung sa bunyon, pag kinapak mo, talagang buto siya. Matigas na matigas, buto siya. Okay? Okay. So hindi siya pareho. Ako, I have bunyon sa paa. Nakikita niyo sa Facebook ko. May bunions ako, meron akong osteoarthritis dito sa daliri ko. Meron akong carpal tunnel, no, tinitiis ko lang, no, pwede pa, no. Papa-opera ko na lang kung kailangan, no. Okay. Okay? Any more questions? Lalaine Victorero, nakita kita. Welcome to our pep talk. So you got interested in this gout. May tanong ka, Lalaine?
Ay, wala naman po, Doc. Nakikinig. Kasi si husband ko meron.
O yeah, anong tanong ng husband mo? Anong concern?
Usually yung mga bawal, Doc, syempre.
Yung bawal na ng bawasan na ng mga pagkain na
Yes po.
rich food, no? Wala siyang kidney problem, ha?
Wala naman.
Okay, that's good. So, then drink a lot of water para
Okay.
ma-wash out yung mga uric acid, no?
Opo, Doc. Thank you.
Okay. Any more questions?
Sir, yung husband ni Christy, namatay, diba, sa gout?
Namatay siya sa gout?
Yeah.
Because of kidney.
Kasi nagbukol-bukol na siya, tapos pumayat na.
Okay.
Tapos yung bones niya talaga, nakikita na lang sa parang na siyang skeleton. Tapos ang lalaki ng mga, parang crystals, pumuputok yung mga sa buto-buto niya. Tapos
Sa
makikita mo yung puti-puti. Oo.
So
Sa kamay, sa tuhod niya, yun.
okay.
Ayaw niya mag-share eh.
Sino? Si Christy.
Si Christy.
Christy, mag-share ka nga. Diyan ba siya? So, siguradong may gout siya, pero how do they die of, how does one patient with gout die? No? Is it deadly? No?
Doktor? Ito ako sa malayo.
Unmute. Abet, unmute mo sarili. Unmute kayo. Kung magkatabi kayo, unmute kayo. Oh, sige, Christy. Go.
Yung kanyang doktor, dun sa paa po niya, sa kamay niya, parang yung mga buto po niya, tawag dyan, parang nauubos po yung laman. Tapos yung pinakatuhod po niya, parang basta lahat po ng parte ng katawan po niya, yung sa binti niya, yung sa tuhod niya, talagang lumiit po lahat.
Hindi dahil baka may gout din siya, pero meron pa siyang
May
ibang
gout
sakit.
talaga, doctor, kasi yung lumalabas po dun sa mga niya, yung parang crystal na puti po.
Okay. So, pero paano, ano ang dahilan bakit? Baka meron pa siya ibang another disease.
Nga po, naninigarilyo po siya, umiinom po siya. Tapos mahilig din po siya sa mga pagkain, talaga matigas po yung ulo. As in,
Kaya nga, so eat in moderation. So, wala tayong magagawa, no? So, most likely,
yun po yung kinamatay niya. Basta nung, po, hindi na po talaga siya nakakalakad. Talagang naging bedridden po siya.
I don't have much experience in that na yung gout ay nagkakos ng death just because na maraming tophi, no, yung puti, no? Okay. Kakaroon lang siya ng it can lead, sabi ko nga, the most common complication ng gout is yung tophi, no? Yung arthritis na may tophus, yung pinaka end stage, yung maraming puti-puti na naka-deposit doon. And the other one is the kidney stones, no? Kidney stones, no? So yung kidney stones, kung stones lang naman, basta matanggal kagad ng maaga, that will not cause obstruction in the kidney, pwede pa rin hindi siya mamatay doon because of the kidney stone, because of gout, no?
Baka komplikasyon din, doctor. Pero yun po yung naging cause talaga nung niya.
Yan nga, baka meron pa siyang ibang sakit, no? Na hindi lang natin ma-identify, no? Okay. So, okay. So, any more questions? Lana? 312? 3, okay. If there are no more questions, sino pa bang Elaine, you're welcome to attend our regular session every Saturday. Okay. Si Shirley. Shirley, kumusta ka na? Long time no see. Okay ka lang, Shirley? Okay. Unmute ka. Okay. Yeah. Kumusta ka na, Shirley? May gout ka ba?
Okay lang po, Doc. Okay lang po.
Wala kang gout?
Wala po.
Okay.
Wala po.
Wala pa.
Wala pa po.
Sige. Basta inom ka lang maraming tubig, iwasan lang yung maraming purine-rich food. No?
Opo. Opo, Doc. Thank you po.
Okay. Okay. Mary, any questions? Mary?
Just a curious thought, Doc.
Can
you have automatic ba yan? Kumbaga magkakambal. If you have tophi, you will have kidney stones?
Not automatic. Pwedeng tophi lang without stones. Pwedeng sabay din. Pwede rin. Anything is possible in this world. No.
Okay, Doc. Thank you.
Okay. Lana? So if there are no more questions, we will call it a day. We will see each other next week again. Okay. I don't have a specific topic in mind pa. I'll just announce it. No? Okay. Wala na. So we'll close it already. Okay. So have a nice weekend to all of you. So we'll see each other next week.
Kayo rin, Doc. Thank you.
Okay.
Thank you, Doctor.
Have a nice weekend.
Nice weekend, everyone.
Happy weekend.